Welcome to week 4 for Nursing 101. Week 4, we are going to be covering chapter 33, which is the introduction to the nursing process. So, week 4, it starts with problem solving. Problem solving is a basic skill of identifying a problem and taking steps to resolve it. A lot of times we use common sense to solve problems, but if that doesn't work, we may try trial and error problem solving or scientific problem solving. With trial and error problem solving, if you think about it, we use it in our everyday life. Examples are like types of hand lotions that we use, laundry soap. We try one, if it doesn't work, we try another one. It is an experimental approach. We test ideas to decide which methods work and what doesn't. And, the experimenter doesn't have sufficient information to anticipate results because until it is tried, one wouldn't know the results. But we have to be careful to adhere to strict guidelines to protect the safety and well-being of individuals and to proceed with trial and error experimentation only with permission and understanding of the individual involved. Trial and error problem solving can be used in lab studies. If it's determined to be harmful or ineffective, they're discarded. Another problem solving technique is scientific problem solving. Scientific problem solving allows researchers to discover the best possible safe and effective treatment for disease or dysfunction. It uses precise methods to investigate problems and arrive at solutions. There are 7 steps of the scientific problem solving, and that is located on and the next thing on page 406, critical thinking. What is critical thinking? The primary goal of nursing is helping individuals meet their basic and higher level needs, but nurses provide care to clients by combining scientific problem solving methods with critical thinking skills to provide care through the nursing process. So, we as nurses may use a complicated mix of inquiry, knowledge, intuition, logic, experience, and common sense. This is known as critical thinking. Critical thinking is neither a trial and error, nor is it a structured scientific problem-solving system. Critical thinking helps the nurses grasp the importance of multiple clues in a client's situation. So when you think critically, you examine facts and compare these facts with information you already know, thereby being actively curious and critiquing ideas for reasonableness. You form ideas or concepts that are mental pictures of reality. With critical thinking, you form ideas or concepts that are mental pictures of reality. Here on me. So, question: trial and error experimentation can be done only with the permission and understanding of the individual involved. True or false? That is true. Trial and error must be used carefully when working with people because of the possible harmful results. So we need to proceed with the experimentation only when we have permission of the individual involved. And here's another slide regarding critical thinking. It is a complicated mix of inquiry, knowledge, intuition, logic, experience, and common sense. It enables you to grasp the meaning of multiple clues and find quick answers when facing difficult problems. And it is important nursing strategy for problem solving. And like I said earlier, it is neither trial and error nor a structured scientific problem solving system. And with critical thinking, it comes over time. It does. You develop your critical thinking skills just going through the courses that you take, as well as when you practice out in the clinical sites. So, the process, so what we have to remember is the process of critical thinking is remembering the facts, using logic, asking key questions, form a mental image, and analyze all that information. So, like I said, we want to examine those facts. We want to compare those facts with information that we already have. We want to be curious and critique ideas. We want to form our own beliefs or ideas rather than accepting the thoughts or ideas of others. And we need to become an open-minded person and be flexible to alternatives. The nursing process. Although you will use critical thinking during your nursing career, it doesn't not give you the framework for solving problems alone. You need to also have the nursing process. The nursing process is a continuous process. It is a framework of scientific problem solving combined with critical thinking skills. It directs the nurse and the client as they together determine the need for nursing care, for planning and implementing the care, and evaluating the results. And then you also have a nursing care plan, which is guidelines that are derived on the basis of the nursing process to ensure consistency among staff members, amongst nursing staff. So the thing of it is with the nursing care plan, it enables the nurse to develop plans of care, which is individualized for each client. Remember, every nursing care plan is individualized for each client. We identify what is suitable and desirable for that particular person. Every nursing care plan you write will always be individualized for each client. It can help manage your time more effectively as you provide care, and a nursing care plan can provide consistency and focus in care. Nursing care plans are also known as critical pathways, concept mapping, or clinical pathways. So like I said before, the nursing process. Nurses and clients work together as partners to promote health, prevent disease and illness, restore health, facilitate coping with altered functioning. So remember, the first step of the nursing process is assessing. The second step is diagnosing. Third step is planning. Then you have implementation and evaluation. And then you evaluate and then you reassess. And if something in that care plan, that process did not work, you start all over again and plan again, implement, evaluate. You are always going to be evaluating the care that you gave and reassessing. So the nursing process highlights the differences in roles between licensed personnel and non-licensed personnel. Is that true? Yes, the nursing process not only includes the actions involved in tasks, but it also integrates critical thinking. Unlicensed personnel are required to know how to take vital signs, in addition to how the licensed nurse must also know why the vital signs are important and what is the relationship of the numbers obtained with the condition of the client. So the effective use of the nursing process allows the nurse to identify not only actual problems, but also situations that might be avoided. It provides them the ability to foresee problems that may avert costly complications. So nursing assessment. What do we do during the nursing assessment? We gather information relative to the problem. We identify our priorities, the ABCs. We collect data, and we update the database. Remember, nurses are nosy people. We want to know everything. So that's why we collect the data. The nursing process is systematic. It is client-oriented. It focuses on meeting individual clients' needs. The needs of the client are identified, and the client and the nurse determine goals for care. It is goal-oriented. It to the client, to the family, and significant others also help determine goals. They have short-term goals. Those are measurable outcomes achieved in hours, days, and weeks. And then we have long-term goals, which can provide guidance for days, weeks, and months. It is continuous. We reassess frequently. We make new goals. We implement new plans. We insert new interventions and reevaluate the success of the overall process. It is dynamic and ever-changing. It contains definitive steps that often overlap or occur all at once. Our nursing process is also a method of communication. Quality of care can be documented as a goal that is completed as written in the original care plan, or as a new goal that is rewritten as a result of the evaluation of the goals. It is not possible for all proposed goals to be successful. So you never want to set a goal that you know a client will never ever be able to reach. We have our nursing diagnosis. That's where we identify our problem. That is a statement or label of the client's actual or potential problem. It recognizes and labels significant data. We are able to recognize patterns or clusters. We identify strengths and problems. We can reach conclusions. We can validate our observations and write diagnostic statements per NANDA. Then we have the planning phase of our nursing process, or the planning stage. That's where we develop the goals for care and possible activities to meet them. This is where we formulate solutions. We describe solutions for actual and potential problems. We choose priority solutions. We implement or initiate an action towards solutions. We establish expected outcome or goals. We anticipate nursing interventions. We prepare to document specific actions that will reach outcomes, goals by stating specific timeline for the plan. This is where we set our short-term goals and long-term goals to suit the needs of our clients. And then we have the implementation. Implementation is kind of like the scientific approach of testing solutions. Implementation is the giving of actual nursing care. It is providing care. Giving medications is in the implementation phase. We take actions that are necessary to achieve goals. We adjust actions as conditions change. We monitor and report results of assessment, goals, and interventions to other healthcare team members. Then the next phase is evaluation. That's we're evaluating the results of our actions and the goals that meet these solutions. An example of an evaluation would be the client walked 40 feet and reported no shortness of breath. So it is a measurement of the effectiveness of nursing care. We are analyzing our clients' responses to the problem, goals, and actions. We identify factors that contributed to the success or failure of the nursing care plan's outcome or goals. We reevaluate and reassess. And we continue with the nursing process in a cyclic manner. We use critical thinking skills, and we determine the success or need for change of goals and actions. So question, which step of the nursing process allows the nurse to identify priorities and collect data? Is it your nursing assessment, nursing diagnosis, your planning, your implementation, or your evaluation? It is your nursing assessment. That's where we identify our priorities, collect our data, and update the databases. So, characteristics of the nursing process. Remember, the nursing process is systematic. The nurse follows specific, orderly, and logical steps based on the client's most important and often most vital needs. It's prioritization or prioritizing. We have to prioritize their needs. It is client-oriented. The client's needs are identified. We focus on meeting individualized clients' needs rather than on performing specific skills. It is goal-oriented. Goals, objectives, or expected outcomes are established as an early part of the nursing process. We have short-term goals, which are measurable outcomes that can be achieved in hours, days, or weeks, depending on the individual problem. And we have long-term goals. That is to provide guidance for the days, weeks, or months during and after the time a client is seen by a healthcare provider. The nursing process is continuous because life and health of individuals change. We have to reassess the client's needs frequently. The existing nursing process must be redesigned spontaneously to fit the most current and highest priority needs. And the nursing process is dynamic. Although it contains definitive steps, these steps often overlap and they're ever changing. So, question. The nursing process happens in a perfect sequence. True or false? That is false. The nursing process is dynamic and ever changing. Although it contains definitive steps, these steps often overlap and sometimes they occur all at once. So, nursing process and quality care. The nursing process is an important tool for providing measurable and observable evidence indicating the effectiveness of nursing care given in any setting. Licensed nurses are responsible or accountable for their actions because all nurses providing care for a client refer to the same care plan. Consistency of care is ensured. It is very, very important for your clients to have consistency of care. If goals are not being met, a re-evaluation will indicate what further needs must be identified. So that is the end of chapter 33 and the nursing process. But remember, the nursing process does not happen in a perfect sequence because it's dynamic and ever-changing. And although it has those definitive steps, those steps overlap, and sometimes those steps occur all at one time. So read through chapter 33, know the steps in the nursing process, which is on page 407. Know which step you give actual nursing care in. The giving of actual nursing care is in your implementation step. Like I said, read through chapter 33. The homework for chapter 33 is open. Get that completed by chapter 33's homework is due week 4 on Wednesday. Your next quiz in this class is not until week 5. So before we get to week 5, I'll give you a quick review of what I would like you to really read through. But make sure you read through chapter 33 and understand and know the steps of the nursing process. And also, know what is involved in the trial and error problem solving and also the scientific problem solving steps. If you have any questions, you can shoot me a quick email and I will try to get back to you as quick as I can. You guys have a great rest of your week and a weekend. And eventually I will meet you all in person. I have talked to some of you on the phone. I've emailed back and forth, but eventually we will meet in person. So have a great week, and just remember, always keep up on your homework. Your homework in this class is always due on Wednesdays. I have changed the time on Wednesdays for it being due to 10 a.m. So I will close it out at 10 a.m. every Wednesday and open it for review, and then on Thursday at 10 a.m. I will open the next week's homework. So please make sure that you get your homework completed, and if you have any difficulties with it, please shoot me an email. Have a great weekend.